As thousands of American workers face layoffs due to the coronavirus, CVS Health has announced it is looking to hire 50,000 new employees across the country. And here to tell us more about the expansion is Chief Policy and External Affairs Officer of CVS Health, Tom Moriarty. Welcome, Tom, and thank you for being with us. This is pretty good news for a lot of people. You're beginning to embark on the most ambitious hiring drive in your company's history, 50,000 new hires. So tell us what some of the positions are you are looking to fill and how people can apply for them.
Yeah, first off, Amy, thank you for having me. We're seeing a growing need for additional employees across our enterprise. And so the job announcements we made yesterday, the 50,000 positions we're looking to fill immediately, they will go across our entire enterprise, including both at our pharmacies and stores, our call centers, at our warehouses, solving for inventory, as well as other frontline individuals to help us address this both on a permanent and temporary basis.
All right, good. And that inventory is a big topic because we keep seeing panic about essential supplies and personal protective equipment. They're unavailable in a lot of places. So how is CVS getting that much needed supply to stores for employees and customers?
Yeah, so across the board, you're seeing real spikes in demand across a lot of different categories, the hand sanitizers, the hand wipes, disinfectants, and as you've indicated, clearly the personal protective equipment. And so we've been working since the start to address this situation. We're working with our suppliers across the country to try to address the needs that we have as well as the needs of our customer.
And this is pretty impressive. You opened up a testing site at your location in Massachusetts where employees are now doing the actual testing. So what else can you tell us about that site and if there are plans to open any more?
We've dedicated that site to first responders and healthcare workers to give them the knowledge, the comfort that they need to know whether or not they have tested positive and their ability to continue helping in this situation. So the site has been up and running since last Thursday. It's proven very successful, and we are working on additional options to bring up more scale than we do even at one location. And so we're working very closely, again, with FEMA and the Public Health Service, as well as the governors across the state, so we can really play the role that we need to, because we're in the communities, each and every area of the country, and we can make a difference, and we're willing to provide those resources to do that.
And you are. It is commendable and incredible that you guys have already done as much as you have. I do have a question, though, because a lot of people rely on those monthly prescriptions to be filled. Has there been a run on medications? Will customers be able to continue to get those prescriptions?
Well, Amy, when this first broke, we did a number of things to make sure we had access to medications. First off, we waived any delivery charges for home delivery. We've provided refills on 90-day prescriptions and waived any restrictions associated with that. We've also advanced and waived copays at Aetna for telemedicine services. And what we've seen is an almost 200% increase in telemedicine visits. We've seen over almost a 400% increase in home deliveries. And so from a supply situation, the viewers should know that roughly 90% of all dispensing in this country is generic medications. And we are the largest, because of a venture we did with Cardinal, the largest sourcing company of generics. And so with that size, with that scale, we've been able to really plan ahead here. We are seeing spikes in some of the medicines that have been talked about as having potential efficacy against COVID-19. And what you're seeing is a number of states now putting in what are called quantity fill limits, or requiring a positive diagnosis for COVID before those prescriptions can be dispensed, because those medicines have real uses for other conditions, and we need to make sure that they remain available to treat those conditions as well. So across the board, we've been integrated with the public health officials in addressing these supply situations.
Well, thank you for what you've done and what you continue to do. Tom Moriarty, thank you so much for joining us.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.